Good evening and welcome to Over the Counter, a half-hour show that focuses on health. My name is Monique E Hammond, I'm a pharmacist, and tonight we will be talking about skin cancers, sunscreens or sunblockers, and common sense. Now, more than 600,000 Americans develop skin cancer every year, and the incidence of all forms of skin cancer is on the rise. The most common types of skin cancer are those related to sun exposure, or in other words, those skin cancers that are related to ultraviolet radiation exposure. And these are the ones that we would like to address tonight. And of course, the sunlight outside is the greatest natural source of ultraviolet radiation. Now, ultraviolet radiation of any kind seems to trigger changes in our immune system, and then ultimately these changes in our immune system seem to be at the root of these types of cancers that are caused by overexposure to ultraviolet radiation or sunlight. So who are the people most at risk? Well, first of all, those people who have already a family history of skin cancer. People who are intolerant to sunlight and get like red patches or almost the dermatitis when they go outside. People with moles, especially people with many moles or what we call multiple moles. And then, of course, people who work outside a lot and because of their work have to be exposed excessively to sunlight. People with fair skin, and we all know those ones. People with fair skin, freckles, blonde or red hair. But incidentally, those people who need to protect themselves the most from sunlight are also those who absolutely insist on getting themselves that tan, no matter what it takes and no matter how many blisters and how many burns they have to endure. And of course, herein lies a big, great danger, because patients afflicted with malignant melanoma often have a history of painful, blistering sunburns dating back to their early childhood or to their early teenage years. Now, malignant melanoma is the most dangerous form of skin cancer. It is not the most frequent, but it is the most dangerous. And it can spread, of course, to other tissues. It accounts for only 5% of all malignant skin tumors, but it is the most deadly. It kills an estimated 6,000 to 7,000 people each year. And this is why we should try to teach our teenagers about protecting their skin from prolonged sun exposure, because it is the young pigmentation cells in the skin, and those pigmentation cells are also called melanocytes, and it is those young pigmentation cells that seem to be particularly easy targets for damage from ultraviolet radiation. And there are statistics out there that state that by the age of 18, we have received half of our total lifetime ultraviolet radiation exposure. And that's pretty frightening, because it shows us that our early years, once again, are most important for that ounce of prevention that it will take when it comes to skin cancers. But of course, the bronzed, cool bodies are staring at our teenagers from everywhere, from the pages of magazines and of advertising catalogs, and also from television screens. And so it becomes even more important for us parents, and of course our job also becomes more difficult to teach our children and our teenagers when it comes to common sense and to the dangers that result from overexposure and unprotected overexposure, I say, to ultraviolet radiation or to the sun. Now, the peer pressure and the pressure from society in general work against us when we try to convey the message: burn today, pay later. Now, malignant melanoma can appear anywhere on a person's body, but about 40%, it is estimated, start in or near a mole. Anywhere the cancer first seems to be popping up as some kind of a brown spot. Now, let's talk for a little while about what a harmless or benign mole might look like. Now, a benign or harmless mole usually is round with smooth edges, and it has a solid color, usually some shade of brownish. And it is also usually smaller than 1/4 of an inch, which is roughly the size of a pencil eraser. Now, we watch for changes in those moles. Watch for changes in size and appearance. For instance, do you have moles that have rugged edges or ragged edges, Is there a variety of colors in the mole? Especially, do you see any black speckles inside that mole? Does the mole feel rough to the touch? And does it itch, hurt, or feel numb? What does the skin around the mole look like? Is it red or swollen, or is it discolored? All of the above could be signs of trouble. Now, malignant melanoma has a tendency to show up on body parts that are intermittently overexposed to the sun, as we say. It is the burning and peeling, and later on the reburning and the repeeling process that got us into trouble with malignant melanoma. Now, in the men, the back is a particular area of concern, and in women it seems to be the lower part of their legs. Now, with early diagnosis, the cure rate is in the 90% range, but there is a chance of 1 in 50 that it might come back or reoccur. So have yourself checked at regular intervals by a dermatologist or at least by your doctor, and most of all, if you have any doubts about a suspicious mole, consult a physician. The most common type of skin cancer caused by exposure to sunlight is basal cell carcinoma. Now we are talking about the most common type. Malignant melanoma was the most dangerous one. This is the most common type. Basal cell carcinoma accounts for about 76% of all malignant skin tumors. And in terms of numbers, we can say that it would affect roughly about 500,000 Americans each year. Now, if it's caught early, then the 5-year survival rate is around 95%. But again, there is a good chance of it coming back. And it is estimated that 1 in 5 survivors will come down with another basal cell carcinoma within 1 year, and 1 in 3 within 3 years. Now, this particular type of cancer targets, again, the fair-skinned people that overexpose themselves to the sunlight. It is very rare in black people. Now, what does basal cell carcinoma look like? Usually it can look like a red patch that keeps coming back on the arms, the legs, or the trunk of the body. And this patch can be tender. And sometimes it attracts the patient's attention because it itches. Then open sores that do not seem to heal, that take a particularly long time to heal, let's say weeks. They should be checked by a physician in order to make sure that this could not be a skin cancer. Pale discolored marks that look like permanent scars need to be investigated also, especially if you cannot remember that you ever had a wound or that you ever particularly damaged that portion of the skin where that scar seems to be appearing. Now, basal cell carcinoma also can disguise itself as a shiny bump, either pink, sometimes even milky white, or reddish in color. Then we also have to talk about squamous cell carcinoma. And this is the type of cancer that accounts for about 19% of all skin cancers. And a lot of it is again due to overexposure, unprotected overexposure to ultraviolet radiation. And although squamous cell carcinoma is not as frequent as the cancer that we talked about before, namely the basal cell carcinoma, it grows faster and more cases actually spread and metastasize. And of course, when something metastasizes or spreads, then it becomes all the more difficult to treat. And this cancer can look again like a red raised growth, like a red patch, or like a wart that bleeds and that scabs. Now, us lay people, if you hear me describe all of these things, of what a cancer can look like, you see that there is massive confusion and that it is very difficult to distinguish between these various aspects, between these various looks. And us lay people certainly are not trained to distinguish between all of these fine details when it comes to skin lesions. Is it a freckle? Is it a mole? Is it a wart? Oh my goodness, is it an age spot? What is a bump and what is a wart? So have all suspicious lesions properly checked out by a physician, because oftentimes a biopsy or taking a tissue sample and actually looking at it under the microscope is the only way that even physicians can tell whether we are dealing with a skin cancer or not. Now, doctors recommend routinely that patients should examine or self-examine their skin and look for suspicious lesions and suspicious moles. We should actually be doing this every 6 months. And for the arms and the legs, it's relatively easy to do. For the back of the neck, the shoulders, and our back in general, we can either enroll the help of a family member, or we can also use a handheld mirror. The handheld mirror actually is quite helpful if you have to do all of this by yourself. So, inspect your skin and look at yourself about every 6 months and see if you can find anything that wasn't there before, or anything that is bothering you or gives you particular concern. Now, it is well known that repeated exposure and overexposure of unprotected skin to ultraviolet radiation of any type causes skin cancer, and that's a fact. So as patients then, we should act in our own interest, and we should start protecting ourselves from this excessive ultraviolet radiation. Now, a standard dermatologist joke goes something like this: if you want a healthy skin, then lead a shady life. And there is a lot of truth to this, because overexposure to the sun does not only lead to skin cancers, but it also dries and parches the skin, leading to premature aging and the appearance of brown age spots. Young people especially do not take any of this too seriously, because it is fashionable to have a tan, as we discussed before. And besides, when we are young, we are also invincible, and everything seems to be so far off in the future that we really do not worry about it today. Also, we have an easy time believing that bad things just will not happen to us. For those of us who know better, however, here are some facts about skin protection in general. Now, clothing, of course, is actually the best sun protector. And hats with wide brims can be quite fashionable, and they can also protect not only the head, but also the ears and the back of the neck and the front of the face. As a matter of fact, skin cancer on the ears is on the rise, and also skin cancer on the lip. So when you go outside, don't forget to protect those areas if you do not wear a hat. For instance, if we look at baseball caps, well, with the visor, they should be theoretically protecting the front of the face, such as the nose and the lips and so forth. However, they do not protect the ears, and they do not protect the back of the neck. And then, if we wear the baseball cap in the new style, with the visor turned towards the back, maybe we protect the back of our neck, but then what about our face, and what about our ears? Dry clothes actually block virtually all ultraviolet radiation or ultraviolet rays. But wet clothes let quite a bit of the radiation pass. So even though you're going bathing and you're wearing the t-shirt, it is not as protecting than if the t-shirt were dry. And then we also have to protect our eyes from ultraviolet radiation by wearing sunglasses. But we have to wear the right type of sunglasses. Just wearing colored glass is not enough. As a matter of fact, that can hurt the eye. Because as the eye is hidden behind that dark glass, the pupil opens up in order to let more light in. And with that more light, you get ultraviolet radiation coming into the eyeball, and this has been implicated in causing premature cataracts and also burning of the cornea. So our sunglasses actually have to be a specialized type of sunglasses, and they have to block the ultraviolet radiation, otherwise they don't do us much good. And I'm particularly worried about those sunglasses sometimes that are sold for little children that really are not protecting the eyes from ultraviolet radiation. So when you buy sunglasses, check that little item out. See if they are protecting you truly. And now, before we talk about sunscreens and lotions, let's take a look at what actually makes up all that ultraviolet radiation that we have been talking so much about so far. Now, ultraviolet radiation has 3 energy levels. There is UVA, UVB, and UVC. Now, UVC is absorbed by the ozone layer, and it is totally absorbed. Some UVB is absorbed, but UVA is not absorbed to any extent by the ozone layer. Now, UVB is the burning ray that causes blistering, painful burns that often lead to medical emergencies. Severe sunburns that are accompanied by chills, fever, weakness, and nausea should be evaluated by a doctor because they are a medical emergency. You got yourself what we call commonly a sunstroke. Now, UVB rays are also implicated in causing the skin malignancies or cancers, but they also to some extent help us tan. However, the true tanning rays are in the UVA range. And I mentioned before that the ozone layer does not absorb these tanning rays. And even though UVA is weaker than UVB in the spectrum, it injures the deep layers of the skin, and it acts together with UVB to cause skin damage. You get, in a way, between UVA and UVB, you can get what we call the proverbial double whammy. Now, UVA is also the wavelength that is mostly used in the tanning booth or tanning parlors. And as I mentioned before, there is no free ride in life. And there is also no free ride when it comes to parching ourselves with ultraviolet radiation, no matter what the source. So someplace around the corner we are going to pay the bill. And skin cancer in so many instances is a perfectly preventable situation. Now, when we talk about protecting ourselves from ultraviolet radiation, then we must also talk about many surfaces that reflect the sun's rays, often at least partially defeating our protection efforts. Now, snow, water, cement on city streets and sidewalks, and then also the sand on the beach do a very good job at bouncing back some ultraviolet rays back at us that we try to block. So don't put all that much faith into a beach umbrella, because it cannot protect you from the sun rays that are, or from the rays that are reflected back at you. So what about sunscreens? Now, sunscreens are chemicals that are contained in lotions and in creams that we are supposed to slather on liberally before we expose ourselves to ultraviolet radiation. Now, they protect us by either absorbing, scattering, or reflecting the ultraviolet light. Now, the sunscreens that we buy in the stores are rated by means of an SPF factor, or the sun protection factor. And people with skin that is fair or very fair should use a sunscreen with an SPF of at least 15. Now, what does that actually mean when something has an SPF of 15? Here is an example, and I'm trying to give you an example that makes the mathematics of it relatively simple. Let's say I have a skin that, if I expose it to the sun unprotected, I have that type of skin that starts burning or turning pink or reddish within a matter of 10 minutes. So then, if I put on a sunscreen with an SPF of 15, that SPF of 15 would allow me to be out there 15 times longer before I would theoretically start to burn. Or the sunscreen with an SPF of 15 would allow me to be out there 10 times 15 is 150 minutes or 2.5 hours. That's basically, in a nutshell, how it is supposed to work. People who have a history of skin cancer should always follow the advice of their physician or dermatologist when it comes to sunscreens. Now, for a sunscreen to be effective in the first place, it has to be applied correctly to all exposed areas of the body and applied in a smooth, uniform layer. It takes about an ounce, or full ounce, I should say, to cover the whole body. Because first of all, we have to put on enough of the stuff for it to be effective. For instance, if we put just some sunscreen on our face and our neck, then we should use about a half a teaspoonful. Because a little dot just here and there is not going to be doing us any good. And apply the sunscreen before you go out for a roasting session. The protecting chemical has to be given time to penetrate into the skin, where it combines then with special proteins in the skin so that it can produce the desired effect. Products containing the sunscreen PABA, or para-amino-benzoic acid, or PABA for short, they should be applied for up to 2 hours before going and exposing ourselves to ultraviolet radiation. For most others, a half hour is sufficient. But going out to the beach and then applying the suntan lotion is not the way to go. The sunscreen has to be applied before. Now, choose a sunscreen that protects both against UVA and UVB. These products are called full spectrum products. So you have to always read the label. It is important to know exactly what we are dealing with, because each product has specific instructions, so be sure to take a minute and read them. And then choose a product that is appropriate for your skin type. And remember that your skin is your friend, so treat it with respect. Now, the skin types are classified by skin color and complexion. And we have type 1 through type 6. Skin type 1 is very fair skin, always burns easily, never tans. Wear a sunscreen with an SPF of 15 at least. A fair skin is a type 2, and that is a skin that always burns easily, minimally tans. 15 again is advised. Then we have the light skin, which is a type 3. And here we have moderate burns, but it tans easily, and there they say 10 to 15, but a 15 is probably safer. The medium skin is a type 4. And that is a skin that always tans well, and it doesn't burn very much. Yeah, there we have again, we go with 6 to 10. I would stay on the safer side, I'd go with the 10 again. The dark skin is a 5, and there we say it rarely burns, it tans readily, a 4 to 6. Again, I'd stay with the higher one. And then the black skin, or the very dark skin, is a type 6. And it never burns, and it becomes deeply pigmented, and there, in theory, we would not need a sunscreen. However, since we have all this problem with the hole in the ozone, and we really don't know what kind of radiation is reaching us at this point in time or will in the future, and since it is a fact that all of the skin cancers that are caused by ultraviolet radiation are on the rise, I would say, if you're in doubt, you don't know what kind of a skin type you have, protect yourself by means of a sunscreen, even if you have dark skin, because it's better to be safe than to be sorry. Reapply your lotion after swimming or if you perspire heavily, such as when you're doing physical exercise or physical work. Now, for use at the beach or pool, a water-resistant sunscreen might be better to use. However, remember that also these products, they are not fused to the skin, and they need to be reapplied now and then, especially after perspiring and after toweling yourself dry. An acceptable guideline is that we should reapply our sunscreen every 2 hours or every hour and a half to 2 hours, unless it is needed earlier because it has been removed through washing it off, rubbing it off, or through heavy perspiration. When applying sunscreen, avoid contact with the eyes. And always protect your children with sunscreen before they go outside. And I know that's difficult to do sometimes because children disappear in a flash, and sometimes it's difficult for the parents to catch them. But try to make an effort. And when it comes to babies and very small infants, then do consult with your physician and see what the pediatrician or the physician recommends as far as an SPF value is concerned to put on the baby or to put on the small child. Now, the FDA is going to require more specific information when it comes to labeling of sunscreen products. Among other things, they want to include a statement what skin type these products are really good for. And here I show you an example. I have a bottle here that I had in my home, and it's of course not for advertising purposes. Remember, this is only for illustrating a case. Now, if you look on this product, it says that it has an SPF of 15, and that's good. So that tells us that, but it does not tell me an SPF of 15 is good for what skin type, for instance. It says that it is UVA and UVB protectant, and that is good, because the FDA is also going to require this type of information so that the consumer knows a little bit more what to pick. Now, products like baby oil or lotions with only cocoa butter and aloe and vitamin E and so forth are only moisturizers. They do not protect your skin from the damaging effect of ultraviolet radiation. And the FDA will come out and will also make the manufacturers mark every product very clearly, whether it contains sunscreen or whether it doesn't. So again, we have to take a minute and we have to read the label. And then we have another clincher. And this is if you are taking medication that sensitizes the skin to ultraviolet radiation, then you should never expose yourself to sunlight without wearing a sunscreen. And even then you might come down with a burn, or you might come down with something that looks red, patchy, or like an allergic reaction or dermatitis. Now, some examples of drugs that are sensitizing the skin are antihistamines in general, medications in the sulfa family. And there you might be thinking of something like Septra, Bactrim, Gantrazine, Gantanol. Or medications in the tetracycline family, such as tetracycline by itself, or acromycin, and then doxycycline or vibramycin. The list is somewhat endless. I had written to the FDA to send me a list of medications that sensitize the skin to light, or to ultraviolet radiation for that matter. And this is what I got back, so you kind of see that I can absolutely not go over this here in my half hour that I have, but it is just to show to you that this is something that is of concern. And before you go out for the roasting and the tanning session and so forth, and if you do take medication on a regular basis, then please double check with your pharmacist at least to make sure that you're not giving yourself any more trouble than what you can get already. So it is very important to check before you go to the tanning booth or before you go sizzling on the beach. Now, a question that is frequently asked: if sunscreens with an SPF number higher than 15 offer really that much more protection over a plain 15? Now, the FDA has testing protocols for sunscreens up to an SPF of 15. However, I have read many an article where dermatologists support the theory that the extra protection that is offered by sunscreens with SPF of 15, 25, 30, sometimes even 50, offer definite advantages for people that have a history of skin cancer, that have had skin cancer removed already, or also for people that are of the Celtic skin type, as we say, the very fair people, that they do in effect benefit from this. Now, to complicate the matter, there are also products out there that are advertised as being sunless tanning agents. And these are chemicals that react with some specific amino acids in the skin and thus give the skin a kind of a brownish discoloration that looks like a tan. And the newer products out there have been extensively reformulated, and they give the skin a more natural brownish hue than some of those older products used to do. Now, by themselves, these agents do not protect against ultraviolet radiation, and they offer no protection against the burning of the skin and also against skin cancer. So we have to read the labels on those products very carefully. Then there is a food coloring agent out there called canthaxanthine, and I always have a hard time pronouncing it, so I spell it out for you. And it is advertised as an oral tanning agent, or a tanning agent that we take by mouth in capsule or in pill form. Now, this product is sold by mail order, it is advertised in certain magazines, and it has also shown up in some tanning parlors around the country. Now, after taking the pill, the chemical is trapped in the fat layers beneath the skin and imparts a color to the skin that is often not within a desirable shade. And some people have been quite upset when they turned a nasty shade of orange. Now, besides, this agent is in very high concentrations in these pills, and in those concentrations it has been known to cause nausea, diarrhea, vomiting, severe itching, and even drug-induced hepatitis, so it can be serious. Now, the Food and Drug Administration, or the FDA, strictly forbids the use of canthaxanthine in the highly concentrated doses that are found in such tanning pills. It is only approved in low concentration as a food coloring agent or a food dye. And this again brings us to the end of our show. I had a good time visiting with you. I thank you for watching, and until I see you again, stay safe, stay healthy, and good night.